Concerns the vaccine can't be made fast enough, but we've also heard some contracting the coronavirus are younger and sicker.
That is right. I think it's in part it's because the vaccine itself is adapting to find more hosts, obviously, and so we are seeing a pickup amongst the younger crowd under 40s. Still between 20, so the numbers between 25 and 40 are much larger than they were in the early days of the pandemic. So yes, hospitals have about 25% of their capacity being occupied by 25 to 40-year-olds, as opposed to the 50 plus, which was the dominant thing in the first wave.
Yes, so just reading that to patients in hospital more than the first wave. Now, a recent study, Professor, by the Public Health England found that people who have already contracted COVID are likely to be protected against reinfection for several months. However, there are still doubts as to whether those with immunity may still be able to transmit to others.
Well, I think that is less controversial. It is likely that as we see with the vaccine, for instance, if you get vaccinated, doesn't mean that you can't catch the virus. The vaccine simply reduces the intensity of the symptoms. And there is a suspicion that it's the same with the immunity you get from having COVID, that is, you still have the virus in you, you just don't display the symptoms. So, in fact, this is a big issue. The other big question, Jenny, is whether and how long this immunity lasts. The problem, of course, is that's the same problem we have with the vaccine. We do not know how long the immunity or at least the protection provided by the vaccine will last. Will it be 6 months? Will it be 9 months? Because the trials were rushed so quickly, the phase 3 trials, there wasn't enough time. Normally, in the trials, they take 2 or 3 years, and then you get a sense of how long the efficacy of the vaccine is. So we are still waiting to see whether there's a 6-month protection you get, both from the vaccine and from having caught the virus, or a 9-month or a 12-month thing. So it's still up in the air, and we're waiting. People are waiting for the data to come in.
And Professor, from Monday, all travel corridors to the UK are going to be closed to prevent the arrival of any new variants of COVID. So they've got some mandatory quarantine, also some fines of up to £500. What sort of government support do you think is needed for the UK's aviation industry if it is to last?
Well, I think that the industry is going to be in considerable trouble. The question is, where is the money going to come from? Much as they might have the good intention of supporting the industry, the difficulty is finding the cash, because we're talking about hundreds of thousands of people, airport employees, we're talking about travel agents, we're talking about the airlines themselves, the support, the services, the providers of meals, everyone. There's probably several 100,000 people that are involved directly or indirectly in this. And beyond, and of course, the thing is that for instance, British Airways is a jointly owned company, and it has the same ownership as Iberia. So it's a British European company, British EU company, and it means the question is who props up British Airways? The European shareholders or the British government, and that remains to be seen.
And also the impact of mental health. I know we've discussed this before, Professor. Can you give us an update on what's happening in that situation?
Well, certainly one of the things that is happening is obviously cabin fever. People have been locked up, myself included, for the last few months, and we've kind of more or less continuously since March, we've had some level of restriction, and combined with the weather, it's winter here, unfortunately. And we have short days, people are locked in, and so the combination of being miserable because of the weather and being miserable because you even if you wanted to go out, you couldn't leave your home. And I think this is leading to considerable pressure, the uncertainty, how long will this last? There isn't any end date on this. The people are concerned about their jobs, their livelihoods. So all this comes together and creates an incredible level of depression, which is which I'm unfortunately I don't see any end it's probably going to be a while, and and of course the NHS is flooded with pressure from COVID and dealing with the immediate effect of COVID, that things like the mental health situation have been neglected.
Yes, and I know you've got seasonal affective disorder, which has happened certainly well and truly before COVID times. And as you said, it's cold and darker days and so forth. A lot to contend with, and that flow and effect, as you mentioned, in terms of the aviation industry. Let's have a look at Brexit as well, Professor, and so many rules and new regulations. How are people coping with it all?
I think this has been the shock that, normally you'd expect there to be 2, 3, 6 months to adjust to the new rules. But literally we've had, as you remember, Janie, with 26th of December, Christmas Day is when the agreements were agreed upon. And instead of a transition period of a month or 2 or 3 to get used to the new rules, 1 week later we had these new rules. And we have the situation where perishables, people importing or exporting perishables, are suddenly faced with veterinary checks, with health checks, and paperwork they didn't know about, or if they do know about, they don't know how to correctly fill in. There is a lack of of the necessary doctors and the necessary facilities to check these things. So things that should take 20 or 30 minutes to prepare a certificate for may take 5 hours, and it means that things get to France or wherever, fresh fish or scallops or whatever it is, aren't getting there in the right time, so they get spoiled on the way. The things that took 1 day to cross over, you could get it over to France in 5 hours, now takes 3, 4 days, and there's a lot of spoilage going on.